It's here and now we must deal with it. The coronavirus, it has now spread to more regions of the country with the expectation that it will get worse before it gets better. Here this morning to help us understand more is Brian Hodgkins. He's a pharmacist and also Executive Vice President of Clinical Operations at Desert Oasis Healthcare. Also Dr. Yutham Kontaxis, a Medical Director of Tennessee Emergency Department with Eisenhower Health. It's good to have you with us.
Thanks.
I think people are confused, they're anxious, there's a lot of anxiety. And when you look at the symptoms for the coronavirus and the ordinary flu, it would appear on the surface that the flu is worse. But you say, doctor?
Well, oftentimes flu has a more sudden onset. You have high fevers, chills, and your body aches. With the coronavirus, it's a little bit different. It's more like a common cold. And then over time, it kind of settles into the lung a little more. And the risk is for people that are at risk, older people or people with comorbidities, they will develop a significant lung problem with it.
And so when somebody starts sneezing or coughing, they're kind of immediately thinking the worst at this point. And what do you say that they should do so that they are prepared but don't overreact?
Well, it's important from our perspective as a medical group in the desert. We've been working with Eisenhower and Desert Care Network to make sure that we have a good strategy and plan to protect our patients. The greatest at risk are 60 and older. And be prepared. We want to tell our patients in the community and our public, be prepared to be told stay at home. That's the safest thing you can do right now. If you have congestive heart failure, COPD, or diabetes, you're at greatest risk. Start social distancing. And Dr. Kontaxis can tell us about those elements.
Yeah, basically for if you start to feel like you've been exposed or maybe you're concerned, really important just to call the hotline, articulate your symptoms, and then a decision can be made whether you need to seek medical care or not.
And you know, now that there is a state of emergency, what does that entail and what does that really mean as far as agencies are concerned?
Well, from a network, from the county, they're basically looking for resources, so test kits, manpower, and protective gear and things like that, which would be what we need at this point. But we're pretty prepared right now. We've been gearing up for the last, several weeks or months and thinking about this, but now I think resources are what they're looking for.
And we're told that there may not be a vaccine for another year. And so in the meantime, though, you say at least for the time being, it will get worse before it gets better.
So the other thing about being a state of emergency means we're having some community spread, at least a single case now, which means everyone needs to be prepared to start practicing that social distancing, stay out of crowded areas, especially if you're at risk. Keep 6 feet from people and spread by droplets. Wash your hands. Don't touch your face. All those things that are common sense. We ask everyone to get educated and be smart, follow the science and the data. And the other thing, not just about the vaccine, is we're still struggling to get test kits and testing capacity here in the desert during a state of emergency. So we want our patients to understand we might not be able to test everyone, but we're going to test those people that need to be tested.
All right, we need to leave it there, but I'm sure there are going to be more questions and we'll have you back.
Absolutely.
All right, thank you. Appreciate it. We'll take a break and we'll be right back. Stay with us.